kids and germs, super combination vaccines for infants, and getting into the exercise habit. This is Carolina's Healthcare System Network News. We're deep into the cold and flu season now, and most parents have shifted into high gear trying to keep their kids from catching colds and other assorted illnesses from their friends at school. So what's a parent to do?
I think more so than germ-free, I think reducing the risk of getting sick is probably a better way of looking at it, because there's no such thing as germ-free unless you're in a bubble. So I think really just trying to minimize your child being at risk for getting sick is the best way to approach it.
Here are some basic tips for kids to follow.
So one, hand washing. That is the most important thing for prevention of infections. Use of hand sanitizer is great too. Kids can also get a great night's sleep. That's good for their immune system. Eating a healthy diet. Also covering their own cough. I usually recommend that they use their elbow. So if they use their hands, they're going to be touching things around them and spreading germs.
But Mom, Dad, don't overdo it. You really can't keep the kids away from all germs.
Germs are part of our environment. Germs live on our skin. There are some good germs that live on our skin, but germs live on every surface that we touch. And so while we want to minimize the dangerous ones, we can't keep ourselves away from all germs. They're just a natural part of the environment.
And here's the takeaway.
I think the takeaway is hand washing is key. Hand washing is the best defense against germs. There's no way to be germ-free, but there's a way to reduce your risk of your child being sick.
A couple of years ago, we reported some vaccine manufacturers were developing shots for infants that combined multiple medications into one shot. The goal? To reduce the ouch factor and make it easier for parents to keep their babies on track with their vaccinations. Fast forward 2 years, and a new combination vaccine is in phase 3 trials and under review by the Food and Drug Administration.
That was very encouraging to see that they feel that they're basically essentially as safe as the individual vaccines.
But some parents may worry their baby's little systems might not be able to handle vaccines combined into one shot. Dr. Richter says parents don't need to fret.
When you look at a newborn infant's immune system, they're assaulted every day with between 3,000 and 6,000 antigens. So this is nothing. This is a drop in the bucket compared to what they're experiencing in the world with different bacteria and fungi and things that live in the world on surfaces. So for them to get all of these things at once is fine. It's a matter of how painful is it to get that into the baby, and that's what these vaccines are addressing. Oh, so sick.
These mega combo vaccines will protect infants against 6 diseases: diphtheria, tetanus, whooping cough, polio, type B influenza, and hepatitis B. And what's the takeaway for parents?
If these are available, I would absolutely recommend that they have them. But if they're not comfortable with that, they can still get them the other way.
The evidence is overwhelming and pretty clear. Exercise does your body good. But the question is, how do you get into the habit of doing it on a regular basis to get the benefits? A recent study suggests it's not what exercise you do, but how you motivate yourself to do it that really matters. The researchers believe that it's the instigation habit, or cues, that prompt people to automatically go to the gym or take a walk, that increase exercise regularity. For example, many people exercise after work. The end of the workday presents their cue to head to the gym to work out instead of driving home. For others, the cue could be the alarm clock going off in the morning that prompts them to go for a jog, a walk, or bike ride. And some research suggests it may take up to a month or longer of repeated behavior before a cue becomes automatic. The trick is finding that cue that works for you. Following that same routine can help build self-confidence. And it doesn't have to be the same exercise over and over again. The cue can help you move on to other exercise routines so you don't get bored. The bottom line is to get moving and make a habit of it.